Good afternoon or good morning, depending on where you are in the world. I'll give folks a few moments to join. And my name is Lakita Shelton. I am the Senior Director here at NABIP, Senior Director of Professional Development here at NABIP. And I would like to welcome you to our webinar, How Technology Can Help Medicare Advantage Members Stay Safe and Independent in a Shifting Marketplace, sponsored by Best Buy Health. Before we begin, I'd like to review a few housekeeping items. This session is being recorded and will be available on the NABIP webinars webpage following today's event. We ask that you please submit questions in the Q&A box and that any chat or any commentary that you may have that you place it in the chat. It's now my pleasure to hand it over to Scott Harlett of Best Buy. Thank you.
Thank you so much, Lakita. It's a pleasure to join you all today and share a topic that Alex and I are passionate about, and that's really how technology can help Medicare Advantage members stay safe and independent in this shifting marketplace. We really appreciate you guys taking some time out of certainly a very busy day as we all get ready for AEP right around the corner. I know we are excited about this season, excited about what's happening in 2026, and excited about this conversation today. So I'll introduce myself. My name is Scott Hartlieb. I am the Director of Strategic Accounts at Best Buy Health. So what exactly does that mean? It means that I work with various health plans that we serve typically through supplemental benefits and around technology solutions that can help their members remain healthy, stay independent, and stay safe and connected in their homes. And I'm joined by my colleague, Alex Tim.
Hi, everybody. Nice to be here today with you. I'm Alex Tim. I'm the Associate Director of our commercial product offerings in Geek Squad Product Management in Best Buy Health. So what does that mean in terms of what do we offer in the health plan space? What do we offer in Medicare Advantage in terms of products, services, solutions to all of you to offer to your members, as well as anybody else in our commercial business? We've got a lot of different lines of business we have. And then, of course, one of our unique differentiators we're going to talk a little bit about today is Geek Squad. So how does Geek Squad actually help enable us to get that reach, get that scale to get into these members' homes? So nice to be here with you all today.
So what we're going to talk to you about and what do we want to accomplish today, Alex is going to share a little bit about who we are, Best Buy Health. We know that you likely know about Best Buy through our brick and mortar footprint and through our electronics retail chain, but you may not have heard of Best Buy Health. So we're going to share a little bit about who we are. I'll talk a little bit about the evolving Medicare Advantage landscape. It's certainly something that we've seen shifting over the last couple years, and certainly into 2026, we expect even more shifts. And then getting into a little bit more of what that means for your clients. So how are they likely feeling about the changing dynamics within MA and within the carriers? And then specifically why this matters for you. And we'll talk through a little bit about how we're helping brokers really help their members through technology that is available today that can be certainly a lifesaver in many instances, if not an improvement of quality of life. So we'll share a little bit more about what we have to offer the broker community. And then, as Lakita mentioned, the chat is open. Feel free to type your questions into the chat, and we'll field those questions at the end. Now I'll hand it over to Alex to share a little bit more about who we are as Best Buy Health.
Thanks, Scott. So again, thank you all for being here. Brief introduction on Best Buy Health. What do we do? How do we do it? And why does it matter? Our focus is on helping people live safely and independently at home. And that connects directly to the challenges and opportunities that we know you're all facing in today's Medicare Advantage market. So we can hop to the next slide here. Our approach, this is a really, really pretty slide. I like speaking to it. So our approach can actually be summed up in the phrase that you see across the top: technology with a human touch that scales. So I'll unpack it a little bit. On the technology side, we're talking about connected devices. Things like our lively alert systems, remote monitoring tools, and connected health platforms. These are all important because they provide that infrastructure that helps older adults stay safe, get help quickly, and remain independent. But as we know, and what we're going to talk to you a little bit about today, is technology on its own is not the answer. What makes that difference is that human layer behind it. Think about Geek Squad agents, as we've talked a little bit about. I help support that line of our business here. You see some pictures here. We've got Geek Squad agents that can go into the homes and get these devices set up properly. We've got our caring center associates, you'll see a picture of in the middle here, where they don't just answer the call, but they respond with empathy and reassurance. And then think about the trust that comes with the Best Buy brand, a brand that millions of consumers already rely on for technology. Now, when you put all of those pieces, all these pictures together, it's not just a gadget in someone's home that we maybe think about when we think of technology. It's a support system wrapped around them. And that's what we mean by technology with a human touch. And because Best Buy has already built national infrastructure, we can deliver that last word, scale, we can deliver it at scale reliably and consistently, not just in one region or for one plan, but broadly across the market. And that's what we're going to talk about here today. You can go to the next slide. So our purpose builds directly on the broader Best Buy purpose, which is to enrich and save lives through technology and meaningful connections. And we've learned that technology alone is not enough, as we just talked about. A device is only valuable if it creates connection, if it helps a member feel closer to their care team, if it provides a lifeline between a senior and our caring center agents, or if it reassures a caregiver or family member who worries about their loved one. That's why our goal goes beyond the technology itself. Our goal not only is to enable care at home for each of your members, but to enable care at home for everyone. It's about scaling independence, not just for some, but for everyone across the system. And as the Medicare Advantage landscape shifts, which we're going to talk about today, with benefits changing, plans pulling back in certain areas, that goal becomes even more relevant because even when benefits shrink, the needs for safety and independence don't go away, but the way that we solve for them has to. And that's what we want to talk about today. Right, next. So the vision we went through isn't just aspirational, it's already happening today. We currently serve over 100 health plan clients, more than 300 senior living facilities, and over 1 million individuals. And each of those numbers tells a story. When we say 100 health plans, that's 100 different sets of populations, geographies, and benefit designs that we've adapted to support. And when we say 300 senior living facilities, that's 300 different environments where technology had to work alongside staff, families, and residents. And when we say over 1 million individuals, that's 1 million people whose daily lives are safer, more connected, and more independent because of these solutions that we offer. For you as brokers, this matters for a simple reason. It shows these solutions are real, they're scalable, and they've been proven in diverse, complex environments. And when you're guiding your clients, you want to know that what you recommend isn't experimental. It's tested, it's trusted, and it's already working for people just like them. That's the assurance that we bring to the table. And now I'll hand it over to Scott to talk a little bit more about what we're seeing in the MA marketplace today.
Thanks, Alex.
Yeah.
Yeah, it's exciting to see the impact that we've had on members' lives. Serving 1 million individuals across the country is not something that we take lightly. It's a responsibility that we take very seriously through every element of our solutions. We'll focus a little bit on Medicare Advantage. Where our solutions come to life today is typically through supplemental benefits. So providing technology to carriers that they can make available for members, again, to keep them safe and connected at home, and also provide differentiation for their plans among the marketplace. One of the trends that we follow really closely is what's happening at a macro level across Medicare Advantage, and it's certainly been a wild ride. Anybody that's been in it for more than a year will know that it's been a pretty roller coaster ride the past couple years. One thing that we've been seeing is the concentration at the top of the market. So, we're partnered with many of these carriers today, and one of the things that we've been seeing is they're continuing to gain more and more share. As you look at these top five carriers, they're responsible for 71% of the members enrolled in Medicare Advantage, and that number is increasing. So that's increasing the amount of power that they have. That's potentially decreasing the amount of choice that members have. Um, and it's just really creating a dynamic that is, um, shifting where the power is, where the differentiation is, and where members are focused on. And it's not any secret to anyone that's listened to an earnings call from one of the major carriers over the last year or so. It's no secret that MA is under a lot of pressure. You can see the quote there from United Healthcare on the left. Continued cost trends and funding pressures are making them rethink their decisions and having to make difficult decisions around exiting in this case, Medicare Advantage plans that serve 600,000 members. On the right-hand side, you can see a quote from Humana. Membership losses driven by exits and unprofitable MA plans impacting 560,000 members. And those aren't just numbers on a page or numbers that are said on an earnings call. Those are individuals now who no longer have the plan available to them. That plan could have been working great for them, could have been providing stability in their lives, and now all of a sudden they're trying to figure out where to go next. What is a plan that's going to make sense for me? Or in some cases, I need to choose another carrier because maybe the carrier that I was a plan member of is no longer in my market. I live in Kansas City. Blue Cross Blue Shield of Kansas City completely exited the Medicare Advantage market, and that was um, quite turmoil around these parts, where all of a sudden, all the members that they served had to go find a completely different carrier. So these trends and these decisions have real impacts on members. The other thing that we follow really closely because we play in the supplemental benefits space is, how are benefits looking year over year, and where are plans choosing to invest or in many cases choosing to pull back. So as you look at these, primary supplemental benefits, one thing that you'll notice, and the ones highlighted in red are ones where they decreased in number of plans they were in from 2024 to 2025. You can see there is a lot of red on this page. 17 of these 20 benefits decreased from 24 to 25, and some of those notable decreases you can see. OTC went from 85% to 72%, so down 13% of plans removed OTC. The meal benefit that got reduced from 9% of plans. Transportation got removed from 6% of plans. So you can see, it's certainly, I would imagine this is not news to you all who see this and feel this every single day. And what I've seen in the previews I've seen for 2026, it's looking very similar. Something that we tend to look at as well, that is more kind of close to the areas that we play, are some of these enhanced benefits. You'll see it tells a similar story as we look from 2024 to 2025. Where are some of the enhanced benefits that saw a lot of change year over year? And in here, 16 of the 22 enhanced benefits saw a decrease in penetration for the number of plans that they were in. Notably, things like remote access technology got hit really hard, going down from 74% to 52%. Um, Things like smoking cessation decreased by 8%. The PERS, which is a benefit that we directly participate in and provide to hundreds of thousands of members across MA, was down 10%. As we look at this, again, these aren't just numbers on a page. These are members who relied on these benefits, who relied on them for quality of life, for safety, for health. And now they're looking at, what am I going to do? The benefit that I relied on is now no longer available to me from my health plan. So that's really where we're going to touch on here in a little bit is, how do we as Best Buy and how do you as brokers really help members who are in a difficult situation as they're looking at, what's happened from their benefits this year, and then obviously going into 2026, what's going to happen with their benefits and what are they going to do to continue to really serve the needs that they already have. So I'll turn it over to Alex to talk a little bit about how we're helping clients and what this means for your members.
Yeah, let's do it. So I know Scott went through a lot of different things there. And as we talk about technology and Best Buy Health, of course, being us in here today, one of our primary offerings is a PERS solution, as Scott had said. So that is personal emergency response systems, as you know. And the reality is this, like we saw, I think was the number, I think Scott had it like a 10% drop in PERS by itself. And the reality is what we know and we're seeing firsthand is your clients still are looking for, still need a personal emergency response system and a solution. Nearly 90% of adults over 50 say that they want to remain in their home as they age. And that desire for independence is nearly universal. And it's not just a preference, it's actually a deeply held value. And 70% say that they're comfortable using technology to help them do that. That's a dramatic shift from even 5 or 10 years ago. Today's seniors are FaceTiming their grandkids, they're ordering groceries online, and they're streaming church services from home. Technology is no longer a barrier, it's actually an enabler. And why does this matter? Well, because as we know, staying at home delivers better outcomes. Think about what happens when someone can remain in their own home. There's autonomy that increases because they're in control of their day. There's familiar surroundings to reduce stress, particularly for people with memory challenges. Loneliness decreases because they can stay connected to their neighbors and their community, and they make better use of local services. From primary care to pharmacies to social programs, home isn't just where people prefer to be, it's actually where they're going to thrive. But here's the challenge. Even as this desire to age at home grows, supplemental benefits are shrinking, as Scott just articulated. And plans are cutting back, and we're going to talk a little bit specifically about PERS, but we'll talk about some other things as well. Their plans are cutting back on PERS. And so more and more, what we're seeing firsthand, because we also offer our solutions directly to consumers through all of our channels, is that more older adults are actually buying these devices out of pocket. That's a clear signal to us that the demand isn't optional, it's urgent. And as we see that coverage change, we're going to see more people shift towards looking for the solution elsewhere and trying to find a way to get what they know will keep them safe. So let's go to the next slide. So now, before we go deeper into the kind of the tech and what we have and what we're seeing, we'll pause here for a second and kind of listen to what real people are saying about these devices, because it is powerful. We had one user in the top left here say, "It has been a lifesaver. I was connected to someone right away. When I pushed the button, they were very prompt with getting EMTs here to pick me up off the floor." That is not just a statistic. This is a quote that is a life saved. We've got a nurse on the top right here saying one piece of equipment that every elderly or disabled person who lives alone should have is a personal emergency response button. That's a healthcare professional saying This should be as important basically as having a smoke alarm in the home. And I've heard a lot of people refer to it that way. This is a safety mechanism that's going to allow people to be safe and independent in their home. We've got another one of our clients that shared, I can't express how grateful I am for the service. It gives me peace of mind and my son peace of mind. Think about that for a second. There's one device, one solution, a piece of technology that's easing the anxiety of both generations. And then we have another caregiver that summed it up simply as, this is a great device if you want to keep your loved one safe reliably. These voices matter because they highlight what PERS really represents. It is not just a button, kind of going back to the beginning of this conversation. It's peace of mind, and it's more than just the technology. It's that human connection. It's confidence for someone living alone. It's reassurance for a caregiver who can't always be there. It's dignity, the ability to stay independent without sacrificing the safety that they want and need. Next slide. And here's, hopefully you find this as interesting as I did when we ran all these statistics. And these are real statistics based off of our calls that we're getting in through these devices. And a lot of people don't know this. And so I think it's a good thing to talk about. It's actually more than just an emergency response button. PERS is not just, you click it when you have an emergency. Urgent response that you'll see up in the top there is the foundation, yes. But when we look at how these devices are actually used, the story is actually much broader. People call us with safety concerns, falls, feeling unsafe at home, or being lost in the community. They call with medical needs, prescription refills, questions for a primary care provider, even durable medical equipment. They call for advocacy, needing help navigating Social Security or insurance questions. These are things to keep in mind as you're talking to your clients about what do they need. This is where PERS is actually a great solution. Mental health support is a huge category. People call when they're lonely, anxious, or just needing reassurance. And sometimes it's just the basics, help with utilities, transportation, or food. So the data here is telling that story. About 27% of calls are urgent needs. 16% are mental health, 11% medical, 10% advocacy, 9% basic needs. That means that more of half of the interactions are not emergencies at all. Put in the comments if you would have thought that coming into this conversation, that more than half of them are not emergencies at all that we're getting through these devices. They're actually everyday life needs. And what starts as a so-called emergency button, as the way most people think they are to start with, but once they start using it, it really becomes a trusted connection point for them. It's a bridge to the broader support system, that human connection, all of those complementary services and things that we can do that keeps people safe and independent. And a lot of times it's that word technology, right? Or the device that really hides a lot of what you can actually get for value out of this type of solution. We can go to the next slide. So moving back to the technology for a minute, because I know we kind of want to talk a little bit about technology. This is just one of our devices. It is our best-selling, most selected device specifically for PERS. We have many options in our portfolio, but this is our flagship. And what makes it different is not just the features, but how those features directly address the real risks. So it has built-in cellular, which ensures reliable coverage, whether it's in homes without maybe landlines or high-speed internet, or when users are out on the go, out and about, they can take that safety, that connection with them anywhere. We've got GPS tracking, which is critical when someone wanders, gets lost, or can't communicate with their location if they do need help. And something that we don't actually have on here that you may not know is we actually even offer an app. So if there's a family member, a loved one, friends, or caregivers, we have a complimentary app that goes with this device for those individuals to be able to check in on the individual wearing the device to view that GPS location. They can view the device status, the battery level, the recent events, and more, kind of giving everyone that's involved that greater peace of mind that we've talked about. We have two-way communication, which allows for having a real empathetic person respond instantly. We have a long-lasting battery, lasts up to 40 hours of coverage, reducing the risk of being unprotected. It charges really quickly. making it practical for daily life, and it's water resistant because many falls, as we know, I bet you if we surveyed everybody here, you probably know most falls, a lot of falls actually happen in the shower or in the bath or in the bathroom. And of course, having fall detection on the device is literally life-saving when someone can't press that button themselves. So this technology stack isn't just stats on a page or stats in a feature set. This is actually solving real problems for these individuals. This device is the piece that most people start with, but it's not where we are stopping. As the needs of users advance, so are we at Best Buy Health. We have a smartwatch wearable on the horizon. We're working on ambient monitoring solutions so people don't even need to wear these devices when they're at home in the future. And we're always developing kind of what comes next. Every one of these steps is about meeting real scenarios that your clients are facing every day and making safety and independence even easier through technology and our meaningful connection. Let me hop to the next slide. And here's why our clients love it. First, it delivers immediate help at the press of a button, kind of like we talked about. It's not only for emergencies. It can be used for everyday needs like arranging transportation, scheduling appointments, or simply just needing someone to talk to. Second, it is affordable and it's backed by Best Buy, a brand that people already know and trust. That combination of low cost and high trust is rare, and that's where we kind of step into this space and really dominate. And third, the fall detection technology is a game changer. Families tell us that feature alone is why they choose Lively, which is the name of our device, the Lively Mobile Plus or the Lively Mobile 2, the Lively Mobile Pendant you may hear, because it provides safety even when the client can't act. So what does all of this add up to? For users, it means dignity, independence, and safety. For families, it means peace of mind, less anxiety, and confidence their loved one isn't alone. And for all of you, it means you have a practical, proven, and affordable option to recommend. That's not just about the technology, it's also about that connection and all of those complementary services. And whether it's included in a plan, benefits or not, we have ways to get this technology into their hands. And actually, great segue there is with that, I'll actually hand it back to Scott here, and he can talk specifically about why this maybe matters to you.
Thanks, Alex. So that was a great kind of overview of, who Best Buy Health is, what we're seeing in the market, and the tightening of supplemental benefits, how we view technology and really the importance it can play in a member's lives. Now, why does this matter to you? And I think the backdrop is technology, as we showed by those stats. Supplemental benefits are being tightened. A lot of the technology benefits are being removed from plans, specifically around PERS, specifically around assistive devices. Some of the OTC benefits where members could use some of that funding to buy some of these types of devices as well is going down. But the need continues to be there. I was actually at an event hosted by Anthem in Nevada last week, and it was an event hosted by the regional sales manager there, and she was passing out the 2026 benefits books to the brokers. And the brokers were coming in, and I had a chance to talk with a lot of them, and they said, Scott, this is great, for members that have these benefits still in their plans. This is great. But I have a lot of members who are now on plans that don't have this technology. And they've relied on it for so long. What can Best Buy Health do, or what are you going to do for all these members now? And luckily we had been thinking about this for quite some time, and we put together a program specifically designed around the broker community, around members who don't have access to these types of technologies anymore embedded in their plan. So I'll share a little bit about kind of what that looks like. So today we have partnerships across many of the large carriers. Anthem WellPoint is our biggest partner. We have a great relationship with them, and certainly if you work with those plans today and have members on on those plans that have PERS as a supplemental benefit and they're eligible for it, I encourage you all to assess their needs, think about is that a right fit for them, and encourage them to take advantage of that no cost benefit. I tell people all the time, it's better to have it and not need it than need it and not have it. So certainly that is one avenue. If it's a supplemental benefit that's available to your members, certainly encourage them to take advantage of those supplemental benefits. If they're in the camp where they don't have access to these benefits, we built a program specifically designed around the broker community and the members, and it really has two main parts. Um, the first is the benefit for the members. So we're providing a discount to members to access our services. So while they do have to pay out of pocket, they're getting a discount as part of this program. So that's the value to the members, the value to the caregivers. Um, on the other side, it's a value to brokers. So through this program, we're offering a $25 referral bonus for every member that signs up for the PERS benefit. So that's, we understand obviously there's a lot of shakeup around broker compensation, and we know that's a concern that many of you are probably feeling right now. So if there's ways that you can not only help members that need access to this technology and provide them with a discount, but also get some compensation on the back end, that's really what we wanted to do and how we want to design the program. We'll share with you. We'll follow up with an email after this and share with you a little bit more detail on the program itself, how to sign up for it. This is a time of year that is certainly really, really busy. We know you have a lot on your plate. What we would ask of you and what we would want you to do is really look out for your member. We know you're already trying to help them get to the plan that's going to be best suited for their needs, but also your members best. You know who those vulnerable members are. You know who those members are that maybe are frequent callers to you because they have needs, or maybe they're lonely and need somebody to talk to. They are prime candidates for a service or technology that we have to offer, and we want to make sure that they have access to it. So we would encourage you to keep a lookout for those members and refer them over to our service. Again, they get a discount, you get a referral bonus, and it's really a win-win program. So, as we go into this AEP, we're really excited. This is kind of our Super Bowl time of year. We're excited for all that's going to transpire over the next couple months, but we also know that there's a lot of change happening. There's a lot of trepidation. There's a lot of uncertainty, and we want to be there for you and be there for your members. We'll take a look. That concludes kind of our presentation. We've certainly enjoyed our time together. I'll take a look in the chat and see. We'll see what questions have come in.
Yeah, feel free if you have questions too. Drop them in the chat. Drop them in I think there's a Q&A, maybe even a module as well. Whatever works for you. But we would love your feedback, your insights. What are you seeing around how these things are changing? What are your concerns? We can tell you a little bit about how we're thinking about it and how we're approaching it. Similar to all of you, we're looking at this not only what's happening now and what's going to be, rolling out for 2026, but also 2027 and forward.
Questions just came in from Amanda. How is this different than the Nomo product? Alex, can you speak to that?
Yeah, I think the way that we position our product, especially our PERS product, is really around the small form factor, being mobile, and the connection to the caring center. The Nomo product has a few additional things attached to it. We also have solutions that are more inclusive as well. But our device is intended to be sleek. It's intended to be light. And the algorithm in it, we actually did a study based off of many of the leading competitors out there in the space as well. And what we found is our algorithm detected more falls. So in that case of fall detection that we talked about being a critical component, it was the best in the industry. And we do know that our prices, if you're looking at people that don't have this as a covered benefit that would need to pay out of pocket, we know that we have the lowest rates that are out there. We have no contract as well. And so we are really focused around the member experience. And then it's our caring center that's really a huge differentiator as well, outside of just the technology. As you saw the ways people were engaging with us on that previous slide that we had there, that outlined all of the different scenarios they could reach out and we can help support them. That's something that is unique to us here. And all of our support representatives are employees here in the United States. We don't outsource that component of it. We take a lot of pride in talking to a US-based agent. These are all employees, like I had said. So it's really the connection component and really that full end user experience. We are also evolving our product portfolio. And so as you think about the capabilities of the devices, that'll be ever changing. And, maybe we'll be able to come back here next year and talk to you about some of the exciting things that we have coming for future years as well. But it's really the whole package that you're getting with us.
On that note, Robert asked about additional product offerings in addition to PERS. So what we have available today for this specific affiliate program is PERS. We also, within the Best Buy Health portfolio, we offer senior-friendly cell phones under the Lively brand. So you may have heard of the Jitterbug phones. That is one of our products. So it's really designed to be suitable for this population. I know, although the flip phones I know are coming back and popular with the kids these days, we have a flip phone available as well as a smartphone. Not only does it have all the features of a phone, but it also has connection into our caring center as well for those types of urgent response issues. Kind of foreshadowing into the future, we are looking at different offerings that relate to tech support. So Best Buy Enterprise it's called My Best Buy Memberships. It's a kind of a tech support type of offering where regardless of where you've purchased your technology, you can connect with us and we can help you support it. So, we know technology can really be the lifeblood of many people's lives. You think about the importance of a TV for someone who is homebound or an internet connection for someone who needs connection to the outside world. These things are, really, really important. And when they go down, that can be really detrimental to not only somebody's, physical health, but their mental health as well. So we have services that offer technology support for members to help make sure that their technology is always up and running.
Yeah, and as we look forward too, like we are working on I mean, you all know like the product cycle in terms of development to getting it in front of some of these plans to having it included. It's a long cycle. And so we're actually going through that process right now. Of course, we have direct to consumer offerings as well, but for members to get something as like a supplemental benefit, that's a long process. And we're working on things like I had teased out earlier, ambient monitoring solutions, which you may say is Amanda, I think that question was from you on Nomo. One of the capabilities of Nomo that they touch a little bit is sensor-based type things, right? To see, if somebody's in a room or something like that and see activities. Well, we're taking that like 10 steps further with ambient monitoring solutions where you can actually detect a lot of different things about an individual. So that way they don't even need to wear a pendant while they're in their home. We can detect vitals. We can detect activity levels. We can be even proactive and predictive around certain conditions. So like that's some of the exciting things about when a person comes into, we like to think of it as an ecosystem, into the, whether it's the Lively device that they start with. There's a lot of other complementary things that we have now in the direct-to-consumer space, or even in the future as we see technology being more of what's included in these plans and they're focused on, not just PERS, but how do we use technology to make a difference to allow these people to live independently, healthier, longer as well. So that's another thing that we're looking at there. Med management is another really important piece of the puzzle here. We know how critical it is for if somebody has a medication that they need to take, not to forget to take that medication. We've got some offerings there that we're also working on and building out as well that based off of what we've seen from a competitive set are going to be the best in the space. So of course I'm biased on that, but I think it's a pretty exciting opportunity. So and we do have on as part of the wrap up here and in the, I think after it's done, we can shoot you all an email. But if you have like more questions as well, I would love nothing more than to connect with a few of you too. And I know Scott would as well. You can email Lily. And if you have other questions or you have ideas, you have thoughts, or you want to know how something compares to something else, we can definitely do that there as well. So this isn't the only opportunity to connect with us. Our goal is to make it so that way you can connect with us on a more frequent basis as well.
Then it looks like Robert asked around the cost of the PERS. So there's kind of two models. One, if it's a supplemental benefit and it's included in the member's plan, it's typically no cost. So today, I mentioned we have a partnership with Anthem and WellPoint plans, so that PERS is available at no cost to the member, no cost for the device or ongoing service. For the out-of-pocket cost, if the member does not have it for a covered benefit, today it starts at $24.99 a month, which if you do any sort of competitive shopping around, which we do every single day, you will find that we are the lowest cost on the market. There are a lot of our competitors that really unfortunately take advantage of people who potentially are in a vulnerable position, or in some cases it's the caregivers who just want peace of mind and will pay whatever it costs for this service. I mentioned I was in Nevada last week. One of the brokers came up to me and he said, I didn't know you guys had this, and I didn't know that it was available at such a reasonable rate. He said that he was currently paying out of pocket for his mother. He was paying $650 a year for her PERS service, and he said, it didn't matter what it cost to me. I just wanted to pay and feel that peace of mind. And I said, well, you can feel the same peace of mind for a lot less money with with some other services, namely ours on the market. So that's how it's structured today. Through the program, the member gets a discount on the device, so we'll give them 50% off of the device, which is a great discount for them and a benefit for the program.
Yeah, and a really cool thing about it too is we have no contract, right? So we're not going to lock you into you get a low price, but it's for a year or two or three. It isn't. If it's not working out for them, we don't want to, as Scott said, like we don't want to take advantage of this population. We have the reason why we can do that is we have data, we have confidence, and we know the experience is great. And when people sign up for it, they just stick around because it's great. And it's that peace of mind that they want at a budget and a price that they can typically afford. So yeah, we've tried to make it as accessible as possible to as many people as possible because we know how much of an impact that it can make. I tell you, I get the fortunate, as well as Scott and many on our teams here, where we get to listen every once in a while to some of the calls from our caring center on the impact that we're making. We had that slide in here with 4 quotes that we had from either users or people that have seen people using it, nurses, caregivers. But being able to listen to some of these calls of people giving feedback after an event. Like we could sit here all day, and there's some heart-wrenching calls that you're like, oh my gosh, this is so incredible. To there's a story of an individual that in one of the horrible hurricanes that happened not too long ago, where the phones were down, there was no power. They literally couldn't access or get help from anyone, and they needed somebody to know where they were. And it was their PERS device that saved them, that we were able to help coordinate to get somebody to help them. So you never know as an individual when you're going to need something like this, and it's pretty powerful to hear all of those wonderful stories. And you think about it, and it's like such a small amount, right? And especially if like all of you can help people navigate to a plan that offers a benefit like this, that's even better because it's already included in their premiums. So.
Well, it looks like we have answered. Are there any flyers for this? There are. So we will be following up after this with an email. As part of your registration in this, we have your email addresses. So we'll be following up with more information about this program and about the services. We know this is a time where you're going to be in front of members over the next couple months and want to get you this information because we know it can be really important to your members. So we'll follow up after this with the information on the program and how to sign up and get registered.
Yep.
And with that, I'll just kind of thank everyone again for attending. I know everyone's schedule is very busy. Certainly this time of year is very busy for all of us. So we really appreciate you all joining and listening to us, and hope that you can take away something from our conversation. And really, as you're interacting with members during AEP and really throughout the year, if there's any help that you can provide them, certainly please do so. And if there's any way that Best Buy Health could be of assistance and help, please reach out. And we are really out there to support you, to support the members, and really help people stay safe and connected in their homes.
Thank you all.
Thanks, everyone. Have a great AEP.
Scott and Alex, amazing job. Again, thank you to Best Buy for sponsoring this webinar. And we thank you all for spending time with us today. You will receive follow-up information after today's webinar, and the recording will be posted on today's NABIB webinars webpage. Thank you and have a great day.
Thank you.